Hi everyone. Okay, so today I'm going to talk about a few things. The first thing is the world's most common STD. The second one being how sex is related to cancer. And the third one is just a little pet peeve of mine. So let's talk about you and your cervical cancer. When you hear the word cervical and what it means in relation to your body, it actually means two parts of your body. The first is your neck. So the part of your spine that makes up your neck is called the cervical spine. The second part is the lower part of the womb, of the uterus, and that's what we're going to talk about today. So let's start off with the anatomy of the female reproductive system. So we're going to start off with the uterus. So that is a pear-shaped muscular hollow organ. I did have a pear, but somebody ate it, so I have a substitute. So here's my avocado. So it's kind of shaped like this. So you have your uterus, and then connected to the uterus is the vagina, the vaginal canal. So this is where my pet peeve kind of comes in, because people usually refer to the vagina as the outside part of a woman, but that's not the vagina, that's the labia. That the vagina is on the inside. So if you can see the vagina, then that's called a vaginal prolapse, and you should probably go see a doctor. We have the uterus, and coming off the uterus you have the fallopian tubes, which transport the eggs from the ovaries into the uterus. Now the last 4 centimeters of the uterus is called the cervix, and it's a cylindrical, so it's almost like a 4 centimeter long muscular tube, and it's kind of tightly closed, but there is a space that goes through it, and this is the space from inside of the uterus to the vaginal canal. The environment inside the uterus is very different to the environment in the vaginal canal. The vaginal canal is very acidic. So you have the cells that line the inside of the uterus, and as they come out through the cervix, the acidity and the change of environment causes these cells to change. So inside of the cervix, you have this, they call columnar cells. So they're basically shaped like bricks. So they're just this rectangular bricks, and they're set side to side. But as it comes out into the vaginal space, it has to change so it can survive. And they basically become flat cells, and they're laid on top of each other. So this transition from the brick-shaped cells to the flat cells, this change can be seen, and this change is very important because this space where it happens is called the transformation zone or the transitional zone. 90% of cancers occur at the transitional zone. Another thing to keep in mind is that cervical cancer is caused by the world's most common STD, human papilloma virus, HPV. So it's been estimated worldwide there's around 600 million cases of diagnosed HPV. There are 150 different types of the HPV virus, but the majority of them don't actually cause any problems. If you do get infected by them, majority of them, without any treatment, your body will get rid of it in about 2 years. The problem comes when we have these 2 types of HPV viruses that do cause problems. We have what we call the low risk HPV. So these are the ones that might not cause a problem, but some of them can cause warts. So this is where genital warts come from. So if you have this type, treatment is very easy, but it is a low risk type of HPV. But the problem is when some of these viruses, especially the high risk ones, they persist. They get into the cervix, they get into the transformation zone, and your body isn't able to get rid of them. That's when it causes a problem. So from the time of HPV infection to full-blown cancer, it takes about 10 to 20 years. And within this time, there are no symptoms, there are no signs, there's no indication that you have a HPV infection. Just like with everything in medicine, prevention is better than the cure. Especially when it comes to cancer, it's better to prevent them than try and treat them. So when it comes to cervical cancer, there are 2 main ways of preventing this disease from occurring or progressing. The first off is stop infection. The main way that that's happening now is through vaccinations. So now you're having vaccinations for young boys and girls, maybe around 11, 12 years old. they're vaccinated against HPV, that means the chances of them getting HPV in the future will be very, very low. The second critical aspect of preventing cervical cancer is screening. So screening means trying to detect a disease before it starts causing problems, before it starts having any signs and symptoms. So cervical screening is something that's done to detect whether you have any changes in your cervix or HPV infection. So before, it used to be a pap smear, but now it's a HPV test. So you go to the clinic and they swab the cervix, and then it gets sent off to a lab and it says you have or you don't have HPV. If you don't have HPV, that's great. You come back for another test, maybe in 3 or 5 years. If you do have HPV, other tests are done to determine, is it low risk or is it high risk HPV? And then from there on, there's other tests and other treatments to determine what to do next. If in the past maybe 3 or 5 years you've had multiple sexual partners, I urge you to go and get this test, because like I said, you will never know if you have infection or somebody else has infection, and it can persist. If it does persist, it persists for a long time. So I urge you to go and contact your gynecologist or your healthcare provider and get it done. So since HPV is linked to cervical cancer, it shows that sexual activity does have a link to this cancer. And today's topic is about cervical cancer, but HPV is also linked to other types of cancers, including rectal cancer and oral cancer. So it's something that's known to have cancerous effects. And honestly, it wasn't until like maybe a couple of weeks ago that I didn't know HPV was the world's most common STD, because it's not as potent, it's not as visible as other STDs such as syphilis and gonorrhea, whose symptoms and signs are very visible and you take notice when you have it. So this is why it's very important to get screening and to be aware of this virus and the effects it can have, not just now, but in 10 to 20 years time. But yeah, that's it for today. Thank you so much for taking your time to listen to it, and I'll see you next time.